about to prevent, what are the right plan for prevention of cardiovascular disease. So to start with, for a non-cardiology students, I will like to so what are the cardiovascular diseases? So basically, these are the diseases of the heart and the blood vessels. But important to note, the number one killer of worldwide is a coronary heart disease. And the stroke is another important cause of death. So these are the two important aspects why we are discussing about diet for the prevention of cardiovascular disease, and we'll see why diet is important. So we know that around 450 million population, 450 million individuals are suffering from coronary artery disease, and this was data of 2015. And seeing the prevalence of this cardiovascular disease, WHO has set a goal that there should be a 25% reduction in non-communicable disease, which is predominantly cardiovascular disease, by 2025. And you must know that what are the different causes of deaths in worldwide as well as in India. So ischemic heart disease or coronary heart disease or coronary artery disease is the number one killer in India. You people were thinking it must be on malnutrition or the infection, but remember that the infectious diseases or neonatal mortality is coming down. And I would like to highlight two figures. There is a number of strokes are going up. That's a part of cardiovascular disease. And diabetes, the diabetes numbers, mortality caused by that diabetes is also going up. So these are the three important diseases, group of diseases where diet is also very important. So if you see that these three conditions, stroke, cardiovascular mortality, stroke, ischemic heart disease, it is caused by atherosclerosis. We all know that. So if we see what are the determinants or what are the causes of atherosclerotic cardiovascular diseases, so we can group into the modifiable or non-modifiable. Non-modifiable, basically, we can't change that. You can't change your family history. You can't. Increasing age lead to the increase incidence of cardiovascular disease. Male gender have more incidence or prevalence of cardiovascular diseases. Ethnicity. We Indian have almost 1.5 to 2 times of cardiovascular disease compared to the Caucasian population. So ethnicity is also important. Among the modifiable risk factor, you can see that they are grouped into the behavioral, environmental, or biological. So biological, basically high blood pressure, diabetes, dyslipidemia, or central obesity. These are the biological causes which can be modified, but they cannot be taken away from as a risk factor. High blood pressure, you can control that. Diabetes mellitus, you can control that. Dyslipidemia, you can control that. Central obesity, you can control that. And there are risk factors which are behavioral only, meaning by tobacco. You just stop the tobacco, you have eliminated one risk factor. Modification in the diet, physical inactivity, that's a very important risk factor. Stress and sleep disorder. Stress is one of the important cause for the cardiovascular death, especially in the younger population. You must have heard that a techie person is exercising on a treadmill and suddenly succumb to cardiac arrest. Sleep disorder. Here, sleep disorder, lack of sleep is not so important, but the obstructive sleep apnea is very important cause of cardiovascular disease. And frequently ignored contributor. This is not established risk factor, but it's said to be a contributor. That is a childhood obesity. And you will see that the daily adjusted life year, that is the measure of a morbidity. If we see that the malnutrition is the number one cause of daily, and that is based on the global burden of disease 2017 data, it is almost 15%, and followed by dietary causes. And if you see that if you bifurcate or trifurcate in what leads to this disability Disability is that the majority is caused by cardiovascular disease, the blue one, and some is caused by the diabetes. So remember, the uh, diet is the, you can see that, if you can see, it is a risk factor, or you can see that it's a factor which leads to disability. So diet is number one. Malnutrition, basically, that is also related to diet, and the different type of nutrition, or you can say a type of malnutrition, that is a diet, is also causing disability. But you must remember, the number one killer as a risk factor worldwide is hypertension. And hypertension is also known as the silent killer, because hypertension per se doesn't cause any symptoms. So now, coming to the main aspect of my discussion, is that the diet and CVD. So you must have heard a lot being discussed about the diet in cardiovascular disease. So what is important? Is it the fat intake which is important? Is it total calorie intake is important? But if diet, the fat, what type of fat is a saturated fat or saturated? Some people are saying saturated fat is not so harmful. Some people are saying that saturated fat is very harmful. You should replace with the MUFA, whether you should be replacing with the MUFA or PUFA. And what is it a carbohydrate? For Indian population, it said it's a carbohydrate is a culprit for increased cardiovascular disease burden. So what is the role of salt? And lastly, I will touch upon what is the role of alcohol and cardiovascular disease. So to start with, I'll talk with the fats. We know the fats are basically divided into fatty acid is divided into three, but depending on the number of carbon double bonds present. Saturated fat doesn't have any carbon double bonds. Mono has one, and more than one, if any fatty acid is having, that is polyunsaturated fatty acid. So that is a broad classification, but important to note this. What are the simple example of these types of saturated fat upon is monosaturated, MUFA or FUFA? So you must be knowing these. What are the example? What are the representative of these MUFA, FUFA resources? So if you see that the saturated fat is the mainly a source is mainly animal fat, and that butter, lard, or even deshi ghee is a good source of saturated fat. Among the unsaturated fat, it's a monosaturated fat. Mainly, it is omega-9 fatty acid, which is a olive oil is a very rich source of omega-9. Avocado oil, peanut, and almond oil are also a good source of omega-9 fatty acid. For omega-6, corn, safflower, sunflower oil, peanut, and sesame oil or mustard oil, these are the omega-6 fatty acid, rich source of omega-6 fatty acid. So omega-3 fatty acid it has to be remembered, because omega-3 fatty acid, we'll see in subsequent slides that omega-3 fatty acid had been found to be protective of cardiovascular disease. Basically, three omega-3 fatty acids are present. There's eicosapentaenoic acid, docosapentaenoic, docosahexaenoic acid, and alpha-linolenic acid. So the eicosa and docosa are the sources mainly fish, especially the fatty fish and shellfish. For alpha-linolenic acid is a very good source is flaxseed. Flaxseed, also known in Hindi, is alsi. Soybean, walnut, rapeseed oil, and even our mustard oil is also having good source of omega-3 fatty acid. So earlier it was said that, especially based on the 7-country study and some key studies, that the dietary cholesterol is directly related to your coronary artery disease. And there is increased dietary cholesterol, there is an increased blood cholesterol, there is leads to the increased buildup of the plaque into the artery, that is atherosclerosis, and it's leads to increased incidence of coronary artery disease. But this simple logical theory is not believed to be true. Why it is so? Because it has been seen in the several meta-analyses. I am quoting only one meta-analysis that total saturated fat is not related with increased mortality. If the patient is consuming more saturated fat, the mortality is not very much related to that. But if you see that if your energy source is being replaced to the by the alpha, this omega-3 fatty acid, there is a reduction in cardiovascular events, cardiovascular death. Omega-3 acid was found to be protective, whereas the trans fatty acid, well, we'll see the example of the trans fatty acid, it is very much related to increase in the cardiovascular death. So saturated fat is more or less neutral, omega-3 fatty acid is very protective, and trans fatty acid very, very, very harmful. And then there was a pure study which was published in 2017, and subsequent that there was several sub-studies published. What this pure studies basically it covered the what are the risk factors and what are the treatment for the atherosclerotic cardiovascular disease. And what it had found that the recommendation by ACC is that the total fat intake should be less than 30% and saturated fat intake should be less than 10%. But this pure study has found that the higher fat intake, including saturated fats, had no association to major cardiovascular events, MI, or cardiovascular disease mortality, which were earlier shown by the meta-analysis. And this was especially true in the low income group or low middle income group, not with the higher income group. And that it also showed that the high carbohydrate intake, more than 60% of the energy intake, was associated with a higher total and non-cardiovascular disease mortality. This is our scenario where most of the people are eating roti and chawal, and they are emphasizing on the roti and chawal, which is a simple carbohydrate. So why there is inconsistency in the fat and cardiometabolic risk profile? Basically, all saturated fats are not as should not be grouped into the one entity because all saturated fats are not the same. There are long chain saturated fat, medium chain, even chain, and odd chain. And what we have found, the saturated fat from the dairy products, especially curd and other milk products, they are very beneficial. And what they contain, they contain odd chain fatty acid, odd chain saturated fatty acid. So what we have learned from the epidemiological studies that saturated fat increases LDL cholesterol, which is a bad cholesterol, and HDL cholesterol, which is a good cholesterol. So every 1% increase in the energy from saturated fat, and there is a increase in the 12 to 17 milligram per deciliter of LDL. Similarly, the HDL is also increased. So both LDL, bad cholesterol, and good cholesterol are being increased. So there is a differential effect. So this differential effect could not be ascertained in prospective studies. So ultimately, portion size is important. You should not be taking too much of saturated fat or too much of polyunsaturated or monounsaturated fat. So a portion size is important. So we already discussed the ACC or even the dietary guidelines, USA guidelines, they have restricted the less than 10% calorie should be coming from the saturated fat to reduce the cardiovascular disease. So we know that the different biological effects are caused by the different saturated fatty acids. So we have seen that the whole fat dairy saturated fat or saturated fat coming from the dark chocolate or unprocessed meats, they are not associated with the increased cardiovascular disease or diabetes. And there is no robust evidence that the current population-wide arbitrary upper limit of the saturated fat, which was given by the ACC or USFD, US dietary guideline of limiting to 10%, will hold true for the Indian population. Because in India, the fat intake itself is very less. we have done our preliminary data collection for the cardiovascular cardiac patient, the saturated fat they have less than 30%, which was prescribed by ACC recommendation. They have much less than their fat intake is much less, and saturated fat intake is much less. So what we have seen that the chocolate, unprocessed meat, and dairy saturated fat from the dairy product, they are not associated with increased cardiovascular disease or diabetes risk. So what are the recommendations? What should we recommend? That fat composition of diet is very important. We have seen that the epidemiological studies that there is a, if you decrease the saturated fat intake by 1%, there is a decrease in the cardiovascular mortality and morbidity by 2 to 3%. So we should be still continuing to hold that 10%, less than 10% of saturated fat should be used. But remember, in Indian population, this 10% saturated fat, the utility they use saturated fat in much less amount than compared to the 10% of their total calorie intake. But what we see is that the whole fat, unprocessed red meat, and dark chocolate, they are not related with the increased mortality and cardiovascular disease. Why it is so? Because they are good source of protein, and they are very good source of the micronutrient, especially the phospholipids and probiotics and all the vitamin B12. They are very good source. So that is how these the blanket reduction in the saturated fat should not be taken, and we should be emphasizing on the type of the diet, which we'll discuss later on. So unsaturated fat, obviously, PUFA lowers the LDL levels, and PUFA have a role in the SDL, increasing the SDL. And we already discussed PUFA is broadly classified into N6 or N3. N3, the predominant source is N6 is a plant, and N3 is many omega-3 is the fish and fats. And what we know that total calorie intake should be less than 30% from the fat, and among of these 30%, 10%, less than 10% should be from saturated fat, and remaining should be from the MUFA or PUFA. We already discussed that, okay, this is omega-3 fatty acid that ACC has long back recommended that every adult should be using fish, which is a good source of omega-3 fatty acids, and the vegetarian people should be using other forms of the derivatives of the omega-3 fatty acids, such as soybean, walnut, flax seeds, and their oil of canola oil, which is also a good source. And in our mustard oil, that is also good source of omega-3 fatty acid. And for the patient of cardiovascular disease, 1 gram of EPA and DHA is also recommended by HA. But remember, the supplementation by the capsule form is not been shown to improve the cardiovascular disease as such. So National Institute of Nutrition, or ICMR, has given a guideline that ratio of N6 and N3 is important, and it should be 3 to 6:1. And basically, most of people, around 50% of the Indian population, is vegetarian, especially the North India population, and upper west is vegetarian, and there the good source is the mustard and flaxseed and rapeseed oil. So about replacing from we have good data about the fish intake and the reduction in the cardiovascular mortality, but we don't have sufficient data about the use of flaxseed, mustard, or rapeseed, which is a good source of omega-3 fatty acid, and reduction or change in the cardiovascular incidence of mortality. A a word about milk, butter, and ghee, because we have already discussed the daily products. Fat is good source of energy, as well as not it is not shown to increase the cardiovascular death or incidence of cardiovascular diseases. So, what we have seen that milk fat is high in the odd chain fatty acid, and these fats are protective for the cardiovascular disease. Milk derivative, just such as the yogurt or curd or buttermilk, are cardiovascular disease protective. And what we know that in India, the butter and ghee are produced from the cream. So this Jaipur heart watch was what a very it was a small study, but it was very good study, and done by the Dr. Rajiv Gupta. What it has shown, there was a significant lower prevalence of coronary heart disease in physically active men who consumed more than 1 kg of ghee, deshi ghee per month, or more than 30 gram of deshi ghee per day. And there was a great difference, almost 5% difference in the cardiovascular coronary heart disease, and a sufficient number, around 2,000 patients in the rural population. So what they have found that why it is so, because ghee contains 60 to 65% of saturated fat, and we already know that the saturated fat from the dairy milk is odd chain fatty acids, and rest as the monounsaturated fat. And this composition obviously can vary from what is the source of milk, whether it's cow milk or buffalo milk, and so and so. So recommendation is based on this Jaipur heart watch study, that the ghee should be advised only for the physically active individual, and that is to not more than 10 to 20 gram per day. And it is not recommended in the sedentary individuals. So remember, most of us as physicians are sedentary individuals until unless you are doing some recreational or any type of physical activity daily. So if you're not doing you are not involving yourself into any sports or any type of physical activity, you are a sedentary individuals. So dairy consumption and the total cardiovascular disease, if you see this meta-analysis, it has been shown to be productive, around 12% reduction in the total incidence of cardiovascular diseases. So dairy milk or dairy product consumption is good for your heart. So ugly part is the trans fatty acid, and that is found in all the food which our tongue likes. All the deep fried fast food, bakery product, packaged snacks, foods, margarine, crackers, and especially remember the reusing refined oil, increasing the trans fats. What you see in today's, you see the halwai, he pours a large amount of oil and continue to fry samosa from morning to evening. So continuous heating of this oil leads to the change in the trans fatty acid. It is very, very much atherosclerotic than the saturated fatty acid or any other type of fatty acid, because it has been shown that a 2% increase in the energy intake from the trans fatty acid is associated with a 23% increase in the incidence of coronary heart disease. So trans fatty acid is ugly, and it has to be curtailed by any cost. This is another depiction of the same statement, that with 2% increase energy intake from the trans fatty acid, there is a 23% increase in the cardiovascular disease or coronary heart disease, whatever you call it. So what are the sources? Sources is hydrogenated oils and fats. The vanaspati ghee, the initially dalda or another type of vanaspati ghee, it is a hydrogenated oils, nothing else but hydrogenated oil. And regular household fried food, just a reuse of oil, Indian fast food, bhatura, aloo tikki, samosa, etc. Whatever you are thinking of this time, they are very rich source of the trans fatty acid. And we should be very careful in seeing the labels. If you see that this label, this says that there's a no trans fatty acid is 0, but again he's writing partially hydrogenated vegetable oil. What is it? Partially hydrogenated vegetable oil. This is nothing else but trans fatty acid. So fatty acid composition, if you see the commonly used cooking oil, if you can see that uh, this red line is for the saturated fat, and for the orange and blue is for the polyunsaturated fat, and yellow is for the monounsaturated fat. If you see that alpha linoleic acid, which is orange, which is maximum in the flaxseed, followed by the canola oil. And if you see that the coconut oil is very, very rich source of the saturated fat. What about the mustard oil? Mustard oil is having 60% monounsaturated fatty acid, and 6% of this is omega-3 fatty acids, and 15% is omega-6 fatty acid, and only 12% is saturated fat. So mustard oil is a good source of all the variants of the fatty acid and a very good source of the omega-3 fatty acid. So what about the carbohydrates? What we have seen that there is a conflicting evidence about the carbohydrate and cardiovascular disease, but we have seen that patient or individual who are taking high carbohydrate diet, they tend to have reduced HDL cholesterol level, and they have increase in the fraction of small dense lipoprotein in small dense LDL, which is more atherogenic. They have higher chances of having triglyceride, and triglyceride and HDL ratio is altered. So high carbohydrate, especially with the high glycemic index food, they may impact on the glucose control and have been linked to the increased incidence of coronary disease. So nature of carbohydrate is important in relation to the reduction of cardiovascular disease. If you see that the carbohydrate source, which is having low glycemic index, they are very protective. For example, fruits and vegetables, they are protective for the prevention of the cardiovascular diseases. So what is glycemic index? Glycemic index, it is the ranking of carbohydrates on a scale from 0 to 100, depending, and the 100 being the very high glycemic. It is similar to the glucose, and and we group them. It is a high glycemic index food or low glycemic index food. If you see, the high glycemic index foods are basically which changes the glucose level rapidly. They change the glucose level rapidly. So every thing which is sweet they have high glycemic index. It's a rough idea. And fruits, vegetables, which have a which is a rich source of carbohydrate, they have a low glycemic index. So how it is changed? We already discussed that it decreases the HDL cholesterol. It increases the small and dense cholesterol, and there is increased chances of increased triglyceride, and all this leads to the metabolic syndrome, which has a direct correlation with cardiovascular disease. And this was a sub-analysis of the PURE study, which was published recently. What it has found that the glycemic index, they have divided into the 5 groups depending on the intake of the high glycemic index food by individuals. The patient who are taking very high glycemic index food, they have very high chances of cardiovascular mortality or morbidity. And earlier, there were few studies which suggested that the patient who are taking high glycemic index food, they have increased chances of cardiovascular disease. But this pure study has clearly shown there is almost 32% cardiovascular increase in incidence of cardiovascular disease compared to the patient who are taking least um, high glycemic index food. So around 32% uh, increase incidence of cardiovascular disease caused by the high glycemic index food. So what should we do? We should reduce the consumption of simple sugars because they are uh, energy dense, and there are some foods which are energy dense and nutrient poor foods, such as simple beverages, all the colas, and then the substitute foods with we should be substituting these high glycemic foods to the low glycemic index and high fiber content foods. And we should be avoiding excess energy intake, whatever the means it is, fat, sugars, or alcohol. And SSB are directly related to increasing the blood pressure. 1 drink per day leads to 1.5 millimeter mercury increase in the systolic blood pressure, and curtailing these sugar sweetened beverages can lead to reduction in the blood pressure. So, and they are directly related to your increased incidence of cardiovascular mortality or morbidity. So protein is there is inverse relation between the protein intake and the cardiovascular disease, meaning by you increase the protein intake, replace your carbohydrate with the protein, it has a beneficial effects, and it is going to reduce your LDL, triglyceride, and even the systolic blood pressure. And plant protein, and they have especially the fish and pulses, they have shown to improve the endothelial dysfunction, which is the precursor of atherosclerosis. And daily proteins, we have already discussed, they are beneficial. So what about the vitamins, antioxidant, and cardiovascular disease? What we can say that naturally they should be consumed as much as we can, but supplementing vitamins, antioxidants, they have not shown to reduce cardiovascular disease. And currently there is no evidence significant of the role of vitamin D on the incidence of cardiovascular disease, uh, or by supplementing it, whether it can reduce the cardiovascular disease. There is no evidence at present. Fiber intake is very important because what is fiber? Fiber is a heterogeneous mixture of polysaccharides and lignin, and whether it is set away, which is edible but resistant to digestion and absorption. It can be grouped into the water soluble or insoluble, and we can see that the soluble fibers are beneficial, and they have been shown to reduce the cardiovascular risk factors. And we have seen that the fiber intake lead to the improvement in the cholesterol. The LDL cholesterol has reduced with the use of the fiber intake. The recommendation is at least we should be using 14 gram of fibers per 1000 kilocalorie. If you have prescribing a diet of 1800 kilocalorie, the patient should be using 14 gram per 1000 kilocalorie. And if you see that what is the source? Cereal is a very good source of the fibers. Whole cereal is very good source. If you give one serving of the cereal, it gives you 5 gram of the fibers. And important to know that when you are using fibers, there is a less chances of overeating, and there is a reduction in the total calorie intake. And we should be advising our patient that he should be using whole flour meal, for the preparation of the roti, etc. And you should be avoiding the processed, or you can say that maida should be avoided by any cost. Fruits, which has edible skin, is a very good source, and best source is the fresh raw fruits. and vegetable, which are green leafy vegetable and seasonal leafy vegetables, and the fruits and vegetables. And we have seen that it is seen to be protective against the coronary heart disease and the stroke. And important to note that the vegetable should not be overcooked. Lightly cooked or raw vegetable are seen to be protective. So recommendation is that we should be using 4 to 5 servings of mini by 400 to 500 gram of fruits and vegetable per day. But in India, this per capita consumption is less than 2 servings, or around 140 grams, which is very, very low from the current recommendation. And all fruits and vegetables should be prescribed because they have almost similar effect on cardiovascular disease prevention. So fruit vegetable consumption and stroke, this study has shown there is if you are taking more than 5 serving of fruits and vegetable compared to less than 5, there is a distinct difference in the occurrence of the stroke. So more than 5 servings per day is seemed to be protective for the cardiovascular disease. What about the fish? Fish is recommended, especially the fatty fish, not the freshwater fish. Fatty fish are the good source of omega-3 fatty acid. They are a good source of the protein. And in the ecological cohort or clinical trials, all type of studies have shown to be protective from against the coronary artery disease or stroke. And but remember the fish oil supplements. This has not been shown to decrease any incidence of cardiovascular disease. So fish oil supplements should be avoided, and patients should be encouraged to use fish, especially the fatty fish, which is a main source is the seafood or sea fish. They should be encouraged. Nuts are good for your heart. Basically, they are high in the unsaturated fats. They are very high in the fiber. They are very high in the protein. And in observational studies, it has been found to be beneficial. So what can we say to the patient? That we should be replacing our simple carbohydrate or simple fat item to the nuts and fruits and vegetable. So what about the salt? Salt is very important because we have seen that it is closely related to your uh, blood pressure. And if you see that if you uh, decrease the urinary sodium reduction by 1.8 gram by per day, that is around 5 gram per day, there is a reduction in the systolic blood pressure of 5 millimeter mercury and diastolic blood pressure of 2.7 millimeter mercury. So it is interesting to know that the salt was not found in our hominid evolution. It was first manufactured 6,000 years back and mass produced only a few hundred years back. And that intersalt study, what they have found that in the Yanomami tribe, there is a very less salt in their diet, less than 1 gram per day. What they have found interestingly that the systolic blood pressure, average systolic blood pressure is less than 100 or around 95, and diastolic blood pressure is around 61. And there is no case of hypertension or obesity, and BP level doesn't change as the age advances. So that is the importance of, you can say, the epidemiological evidence of importance of salt and blood pressure. So what are the source? Source are where we can change or where we cannot change it. So see, if you are consuming restaurant food or packaged food, 80% it is hidden, 10% is naturally occurring, and 10% is discretionary. If you're cooking at your home, 10% is naturally occurring and 90% is discretionary. So food items consumed from restaurant or packaged food, we don't have any control in controlling the intake of the salt. So, but it has been found in the InterSalt study that BP did not rise with age in a low salt population, where the salt consumption is less than 6 grams per day. And then it has been found in the observational study that a difference of sodium intake of 6 grams per day could be associated with the systemic blood pressure change of 5 millimeter mercury. And then it has been also found that if you decrease the salt intake to less than 6 grams, there will be a reduction in the systolic blood pressure of 7 and diastolic blood pressure of 3.8 grams. And we must remember the hypertension is the number one killer as such among all the risk factors. So we already discussed the dietary sodium reduction leads to reduction in the systolic blood pressure, and this reduction in the salt intake will also lead to the reduction in the cardiovascular outcome. You can see that there is a 25% lower incidence of cardiovascular events when the salt was reduced to 25%. Salt was reduced in a population which were enrolled into the hypertension trial. So recommendation is less than 6 grams, but WHO recommends less than 5 grams, which is around, if you see the formula is salt is sodium into 2.5 grams, meaning by the WHO recommendation is less than 2 grams of sodium. So how do we do that? So we should ask the patient not to take different type of salt. What they tend to use is that replace the simple salt with the rock salt or sea salt. There is a lots of advertisement there that the rock salt contains less salt. But remember, this obviously rock salt contains less sodium, but it is around 5% or 2.5% less sodium. If you allow the patient to take rock salt as a supplement, they tend to have increase in the salt intake. वो तो समझते हैं कि साहब हमको तो सॉल्ट तो इससे ये तो अच्छा वाला नमक है तो इसको तो हम खा सकते हैं. So they tend to increase the salt intake, and there is not much difference in the sodium content, whether it is coming from the rock or sea or whatever it is. So you should avoid. You should ask your patient to not to use these supplement or replace your salt. Just cut down your salt intake. Sauces are the very rich source of your salt. And then the gravy browning and the soya sauce and salted dry fish, they are very, they contain very high level of salt. And the food labeling is important. If your food is having 1 gram of sodium per 100 grams of food, it is very much equivalent to saltiness of the seawater. And then we must remember that the breads, cereals, pickles, papad, chutney, namkeen, they contain very high level of sodium. Food labeling, I don't go into the detail, but you know that all the namkeens, papads, chips, all they have very high level of sodium chloride, that is salt. If you see that average salt intake is around 12 grams per day. If you just reduce 12 grams to 3 grams per day, and that will reduce the coronary heart disease by 1/3 and stroke by 1/4. That is, and if you see that what it lead to, it would lead to the around 83,000 less death in India itself. So for the heart failure, we know that there is a compensatory mechanism. There is a salt and water retention for in a patient of heart failure, we have to reduce the salt intake. That is for sure, and that has to be reduced depending on the condition of the heart failure. And depending on the condition of the heart failure, we'll advise the mild sodium reduction, a moderate or strict or severe sodium reduction. So, what about the pure study? The pure study has again showed is non-linear association of sodium intake and the blood pressure, and it is not linear. Earlier studies have shown a very linear relation, but still the sodium reduction is recommended for every individual, especially with the patient with hypertension. Potassium supplement is very important, especially for the management of hypertension, because we know that there is a sodium potassium exchange in the kidney. If you increase this potassium, that will lead to the increased excretion of the sodium, and that will lead to the decreased incidence of CVD. Or so it has been shown that the intake of potassium was lead to there is an inverse relation between the blood pressure level and the potassium level intake. So sources of potassium, we all know the vegetables, especially the green leafy vegetables, are a good source. And then pulses are also good source of the potassium. And then the fruits, peanut, apricot, and the coconut water, and they are very grapefruits, oranges, and they are all the citrus fruits are the very good source of potassium. Now coming to the dietary pattern, why it is important to know about the dietary pattern? Because we don't consume a single nutrients. We don't go to the shop to ask for the carbohydrate, itna de do, protein, itna de do. We ask for the combination of these nutrients, which is a complex matrix present into the food. So we have to analyze the pattern of the food intake, and then we can advise accordingly. So food matrix is important, and what is it? It is a physical domain within the food that interacts with its specific constituent, nutrients, phytochemicals, providing functionalities and behavior which are different from those exhibited by the components in isolation or in a free state. For example, we can think of dairy product. We know that it is good source of the fat. It is a good source of the saturated fat, but dairy product have been found to be beneficial for the prevention of cardiovascular disease. So important to note that we have to choose the food which are good for your heart. Healthy choices are low in fat. They should be high in the carbohydrate, high in the fiber content, and those who are low GI food, they should be taken into the plenty. And then there is yellow food, which should be taken into the moderation. That is a moderate fat, low fiber content, and high GI foods. And red foods, which are not to be taken, or they had to be curtailed, that is the rich in the fat, low fiber intake, high glycemic index, and sugars. So we'll just go to the two dietary pattern, because they have been studied vigorously, especially the DASH diet plan, that is for the prevention of hypertension, and Mediterranean diet plan, which has been shown to be, it has been studied in the hypertension as well as patient with the cardiovascular disease. And DASH diet approach was that it has been shown that they reduce what is the DASH diet, is that the control was it was low in the fruits and vegetable, but basically they have grouped into the three groups: low in the fruits and vegetable and dairy products, and another group is a typical average United States diet, and another group was that is the DASH diet plan, was the which was diet which was rich in the fruits and vegetable, or a combination diet rich in fruit vegetables with low fat dairy products and with reduced saturated fat intake. That was the sodium intake, and the body weight were maintained at the constant level. What they have found, this is a typical plan which is high fruits and vegetable, low fat dairy product, whole grains and nuts were used. Poultry and fish were encouraged to take little red meat, sweets, sugar containing drinks, and reduce protein and saturated fat, reduce cholesterol, low salt, high fiber, and high calcium and magnesium. What they have found, there is a reduction in the systolic and diastolic blood pressure by the use of the DASH plan. And this reduction is more pronounced in the patient who are taking high sodium intake, high salt intake. Another diet which was very well studied is the Mediterranean diet. It is characterized with lots of fruits and vegetables, bread, grains, beans, nuts, and seeds, meaning by high fiber intake and low glycemic index food. Olive oil is the main source of the fat. Dairy products, fish and poultry were encouraged. Little red meat and wine in moderation. And what they have found, there is a reduction in the incidence of the coronary artery disease, as well as the stroke in the woman as well as the men. And this reduction persisted even after continuing the diet for the longer period of the time. So what we think of Mediterranean diet in the Indian context, because they were using olive oil, our population can use groundnut oil or the mustard oil in place of the olive oil. They have protein source from the fish, chickens and legumes. What we can more of the legumes and pulses, less from the non-vegetarian food, because non-vegetarian foods in Indian context is a costly affair. Omega-3 fatty acids. Fish was the main source of the Mediterranean diet. In Indian context, we can use mustard oil, and even we can use flaxseed oil. Flaxseed oil is not to be is very difficult to use as a cooking medium, but we can supplement we can use as a supplement for a carbohydrate, the whole grains, complex carbohydrate, and we should be using less of the refined cereals and encourage the use of unrefined cereals in Indian context. So if you see that dairy products, we should be using frequent use of the dairy products, and we should encourage to use dairy products. In Indo-Indian context, we people are having low consumption of fresh fruits and vegetable, and that should be encouraged. The fresh fruits and vegetables should be encouraged, and we should be emphasizing that the vegetable should not be cooked. They should be lightly cooked or taken in the raw if it is possible. Alcohol we'll discuss later on. So WHO guidelines, we must be knowing that carbohydrate is around 55 to 75%, protein 10 to 15%, total fat intake 10 to 35%, saturated fat less than 10%. But trans fatty acid should be less than 1 gram, 1% of the total calorie intake. We already discussed the sodium content should be less than 5 gram. And plate model, from the Indian nutritionist, it is that we should be concentrating more on the what we can see the cereal and millets. In typical diet, it should be 10 to 15 portions, and one portion is the 30 gram. Fruits and vegetable, it should be more than 4 to 5 portion, around 1 gram, minimum 400 to 500 gram. Pulse and dairy, around 2 to 3 portions, and if you see the pulse, 30 gram is the one portion, and the dairy product is 100 gram. And fats and sugar should be curtailed as low as possible, and fat should be 5 gram per portion, and this portion is around 4 to 6 portions each. So what about alcohol? We know that in day-to-day discussion, we often say that alcohol is good for your heart. So, and even ACCHA recommend that the moderate drinking statement is not like that it is good for your heart, but it is said that if the patient is consuming more alcohol, that alcohol consumption should be taken in the moderation, that is less than 2 drinks per day for the man and less than 1 drink for the woman per day. So, but problem in India is that we indulge in the binge drinking. What is binge drinking? The pattern alcohol consumption that achieves blood alcohol concentration to 0.08%, and which usually correspond to 2 to 4 drinks on a single occasion for men, and more than 3 drinks on a single for a woman within 2 hours. If you see that in layman language, 2 bade pack 2 घंटे के अंदर आपने consume कर दिए, then it is a binge drinking. And binge drinking is harmful. If you talk about the alcohol uh, alcohol intake by the unit system, for the men it is recommended less than 14 units per week, and for women it is less than 7 units per week. And 1 unit is around 10 ml of absolute alcohol, which is almost equivalent to by 40%. If you see the 40% of whiskey, that is around 25 ml of the single measure, and which is, you can see the 1/3 of the pint of beer, which is around 5 to 6%, or half of a standard of glass of red wine. But remember, this unit of 10 ml is from the European person, whereas for American, this unit is around 14 gram. 14 gram for the Americans. But what about what is the effect of alcohol? Alcohol is directly related to your increasing your systolic blood pressure or diastolic blood pressure. And there has been lots of debate. There is some J-shaped curve, because as you increase, there is a increasing incidence of high blood pressure. If you reduce further, there will be increase, meaning by some amount of alcohol is good for your blood pressure. But there is a big but, that in Indian context, alcohol has been always found to be harmful. The biggest example was the Interheart study, which is this study was done in the 7 content, and that in what they have found, that alcohol was beneficial in the European, North American, or Australian or New Zealand population. It was neutral for the Middle East or African, but Indian population, there was high incidence of cardiovascular disease. First occurrence of MI, to be precise, when the patient was consuming alcohol. Almost, you can see that there was significantly higher incidence of first occurrence of MI in a patient who were consuming alcohol. So there is a direct relation of alcohol intake and first occurrence of myocardial infarction. And this study was a study which is a sentinel surveillance study, which is industrial. It was done in an industrial population, and in Lucknow, the HAL was it was conducted at HAL. There was several other sites also. What they have found, that this around 20,000 people, individual were taken into this survey, and 45 people having history of present past in that systolic or diastolic blood pressure was much higher in individual taking. And then it was seen that prevalence of coronary heart disease was much higher if patient is consuming alcohol compared to the non-user. Around 40% overall, occasional alcohol around 20%, regular user around 60% higher chances of coronary artery disease, and the past user around doubling. It was basically because the past users have been advised to stop for some reason. And in this study, it was seen that the locust spirit or Deshi had a much harmful effect compared to the branded spirits. And combining tobacco and alcohol, there is incremental harm caused by the alcohol and tobacco use. So key message is, binging is really harmful. Don't tell anyone that moderate amount of alcohol is good. Alcohol has no role in coronary artery disease prevention. Patients who do not consume alcohol should be advised not to start, and those who consume alcohol should be advised to stop. Very recently, World Heart Federation in January 2022, they have come up with the advisory, what they have written, that any level of alcohol consumption can lead to the loss of healthy life. Alcohol increases the risk for hypertensive heart disease, cardiomyopathy, atrial fibrillation, flutter, or stroke. And it is attributed to many other infectious and non-infectious diseases as well. So World Heart Federation in latest advisory has come out with a very strong statement that any level of alcohol consumption can lead to the loss of healthy life. So should I continue or still awake?
If you want, I mean, this is an excellent opportunity to hear you, and the lecture is so good. You can go on.
All right. I'm asking to the students, I think. So key messages for dietary for prevention of cardiovascular disease. You have to reduce the carbohydrate intake, meaning by especially the high glycemic index food. And we have to move from nutrient to whole foods, meaning by we should not concentrating on the carbohydrate or fat or saturated fat or MUFA or PUFA. We should be concentrating that this type of food is good for health. For example, dairy product is good for health. Fruits and vegetables are good for health. We have to look into the matrix. Increase serving of non-starchy fruits and vegetables. We have to curtail our salt intake, especially when the patient is hypertensive and patient is suffering from any evidence of heart failure. Avoid high salt in cooking and on table. Avoid food with a high salt content. And we already discussed the portion size should be emphasized. If you want to consume saturated fat, consume in moderation. And saturated fat consumption should match with your physical activity, especially relevant to your ghee. Deshi ghee you can have food in the deshi ghee, but you should be physically active to consume that and to digest that. And reuse of oil should be curtailed, minimize the reuse of the oil. So any questions? I think that one part was that we should be having some case discussion. So I have prepared one case that is Mr. KP is a 56-year-old, 84 kg, 158 centimeter tall, hypertensive, and poor diet compliant and consumes lot of salt. His best friend suffered a heart attack a week ago, hence KP is very worried about his own health. He wants to shake off his sedentary lifestyle and reduce his body weight so as to decrease his risk of heart disease. His resting heart rate is 82 beats per minute and BP is 152/92. So what advice would you give him regarding his lifestyle? Anyone who wants to volunteer? Any student wants to volunteer? मैं नाम लूँगा. Deepak, are there? या उसने ऑन करके चला गया कहीं. All right. No issue. I will continue. So, what kind of a special diet should we offer him, and what sort of exercise regimes we should recommend him, and why it is so? So, I will give you answer. So, basically, we have to decrease the trans fat, saturated fat, and we have to ask him to concentrate on the food matrix and the portion size. We have already discussed that saturated fat should be less than 10%. Omega-3, one trans fatty acid should be consumed less, and we should recommend that he should be consuming around 5 servings of fruits and vegetables. Total calorie intake should be curtailed. Dietary fat should be encouraged. We ask them to maintain body weight in normal range, that his BMI should be less than 22. No tobacco or alcohol, and physical activity for at least 30 minutes per day, and of the moderate level the most of the days. For the physical activity, the recommendation is for the prevention of cardiovascular disease is 150 minutes per week in a spell of at least 10 minutes a day. So you can see that 30 minutes, 5 days a week. Or you can have 75 minutes of intense physical activity per week. But remember, for the control of hypertension or dyslipidemia, recommendation is 45 minutes per day and most of the day. So just give you a few examples. What the calorie? One banana is around 100 kilocalorie, and cheeseburger is around 460. And then you can see the pizza is having one slice of pizza is around 250, and one roti is around 60 kilocalorie. Soft drink, one can is around 150 calorie, and 100 ml is around 50 calorie of milk. And then you can see that gulab jamun 2 piece 250 calorie. And for the to burn this 250 calorie, you have to walk for at least 5 kilometers. Samosa, the regular size is around 200 to 300 calorie. 300 calorie, meaning by you have consumed almost 5 rotis. And big size samosa could be more. Dairy milk, 115 calorie. Popcorn, 300 calories. If you decrease your fat content of the milk, you can save the calories. So any question till now? Then we can discuss.